It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center, and our guest today is Dr. Patrick Bitter. And Dr. Bitter is an expert in aesthetics, making people look pretty, making people look younger, and the technology that we've got is so exciting. And when people are starting to feel better on the inside with what we do here at the Wellness Center, there's been a demand for, hey, what can I do to make myself look better on the outside? So Dr. Bitter is here to talk to us about how we can achieve that. Dr. Hotze.
Stacey, thanks so much for the introduction, and thank each one of you for joining us here today on Dr. Hotze's Wellness Revolution. We have got an exciting program today of a wonderful, world-renowned physician, Dr. Patrick Bitter, who is the expert, bar none, worldwide on broadband photofacial lighting to rejuvenate the skin of your face. Now, every one of us wants to feel healthy and well first and foremost. And that's why I believe everybody needs to have a doctor and a provider who can coach you on the path of health and wellness naturally so you have energy, vitality, and enthusiasm for life. Now that you've got energy, vitality, enthusiasm, you want to look good, right? And as we age, we all know it takes its toll. And where is it most pronounced? It's most pronounced on the face. That's what people look at. If you're not wearing a mask, which we don't here at the Hotze Health and Wellness Center proudly, we like to see people's smiles. And when people smile, we want them to have a beautiful smile. We want them to have a beautiful face. So we have a wonderful aesthetics department that was developed for us, and under whom we trained was Dr. Patrick Bitter. Dr. Bitter is located in the San Francisco Bay Area. He's been in dermatology for 34 years, did a residency out there at Stanford in dermatology, and became involved in infrared pulse lighting back in the 1980s and early 1990s. And this was a way, he was really the first dermatologist to use this type of pulse lighting to try to regenerate and rejuvenate the face and make it look younger. So, Dr. Bitter, you've been on a wonderful path over the last 30 years developing these really very innovative photofacial techniques that you developed that now are being used by tens of thousands of dermatologists and on millions of people worldwide to help them rejuvenate their face so they look 10 and 20 years younger. I've been so impressed when I've been to your conferences and seen the tremendous work that the broadband lighting does on facial rejuvenation. What I'd like you to do is explain how you got involved in that and explain to us the process that you use and the machines that you use to enable the skin to rejuvenate itself.
Well, Dr. Hotze, thank you very much for inviting me to join you on your Wellness Revolution podcast and to talk about what my passion is, which is looking the best you can and having healthy and youthful skin. So And thank you very much for your kind and generous introduction of me there. Just like you and your passion, and I can see you've got the book that I have, and I'm very inspired by your writing in the areas of health and wellness. And just like your passion for health and wellness and wanting to inspire people to be able to feel their best and live their life as fully as possible, my passion is, I share that passion for health and wellness. And my passion also is for skin. And I love young skin. I love healthy skin. I love beautiful skin. When I first began to work with IPL, as you had said, which was back in the 1990s, it was a very new technology. My father had one of the very first IPL devices in the entire world, and it was only being used for spot treatments. And And I'm a skin doctor. I treat skin. I don't treat just spots. So when I saw the very few, there were maybe 10 experts in the entire world with IPL back in the 1990s, what they were doing with IPL and what my father taught me how to use it for treating spots, it was very unimpressive to me. And it didn't make people's skin look better. Kind of like the approach to trying to help people, like what typical doctors do, which is giving drugs for problems. And that's not, and your approach is entirely different. Your approach is focusing on what people need to do for wellness. So I began to use IPL in a very different way. I began to treat the entire face. And when I did that, it became a eureka moment, a discovery that was two important things that you didn't get and you didn't hear when you only treated spots. Patients came back after you and treated their entire face, and they said, Dr. Bitter, everybody is commenting on how good I look. And I'll tell you that when you only made 3 or 4 or 5 spots, brown spots on somebody's face go away, or a couple little broken capillaries in the cheeks go away, the world never noticed that there was anything different. But when you treated the entire face with IPL, the world noticed that the skin looked better. And the second thing that patients came back and said, which you never heard when you treated a few spots, was, Dr. Bitter, I have 4 friends who want to come in for the same treatment, because it was such a dramatic transformation, if you will, of somebody's skin. So the procedure I developed with IPL that I called the photofacial procedure 20 years ago, and more than 20 years ago now, uses light, this very special technology, to treat the entire face. And without any downtime and no recovery time, the skin gradually looks younger, clearer, smoother, and healthier. And that totally transformed what we do in the world of aesthetics and how we treat skin.
Okay, so you started with IPL and then it became broadband lighting. Explaining to our listeners exactly what broadband lighting is.
So that's a very good point. Originally, there was one company in the world, an Israeli company, that made IPL. And IPL technology was not well embraced by plastic surgeons and dermatologists, mainly because it was very complicated to use. It was a very expensive technology, very difficult to learn how to use it and to master it, and it caused a lot of potential problems. It burnt skin, it left marks, it left unevenness, and at aesthetic meetings and dermatology meetings, colleagues of mine would stand up and would really criticize and badmouth IPL and say there was no place for it. After I developed the photofacial procedure, that gained a lot of popularity, and other companies began to want to make IPL devices. One of them, a company very close to where my office is in Silicon Valley, California, is Cyton, and they came out with the most advanced form of IPL called broadband light, or BBL. So BBL is the technology that I currently use. It's the technology that you have at the Hotze Health and Wellness Center, and that you use the latest and the most advanced version of IPL. That's called BBL. And for the last 13 years, I've worked exclusively with BBL and have developed a number of special procedures to rejuvenate skin, to make skin younger. And along the way, we have learned what other things BBL does to the skin. Not only does it make skin look younger, but we also know now that it slows down aging, something that's very near and dear to your heart with what you have been teaching and preaching and practicing, which is slowing down the aging process. We now know that skin likes BBL, and one of the benefits of treating skin with BBL is it slows down skin aging.
So when we talk about broadband lighting, what light rays are being used to penetrate the skin and to cause rejuvenation?
Good question. So broadband light is different from a laser. Broadband light uses many different wavelengths of light in the visible and infrared spectrum. So very similar to what a light bulb would emit. It emits light in a visible spectrum called white light. So broadband light uses this same color of light, that we can change somewhat the color of light when we treat people's skin, depending on what we're treating. And we can change the way that we pulse the light. But we're using visible light and infrared light. And as we've learned over the last 10 to 15 years especially, that this color of light or spectrum of light, visible and infrared light, has almost magical effects on skin when you treat it.
Okay, so when should a person get started on their broadband lighting treatment program? At what age is best?
Since we now know that one of the benefits, one of the very important benefits of broadband light or BBL treatments is it makes skin healthier and it slows down skin aging. There's almost no age that's too young to start. And I have now more and more patients that are in their 20s that want to delay skin aging. They want to keep their skin looking nice. And the best technology to do that is BBL. The best way to treat young skin to keep it healthy and slow down aging is the photofacial procedure using BBL that you have been offering for 5 years now at your center.
Now, to get started on the treatment program, in the average age of a woman that comes to the Hotze Health and Wellness Center is about 45 is the average age. We have women in their 70s. We have women in their teens, even young children. But the average the average woman is about 45 years of age. And obviously, whether you're male or female, and that's about the average age of the male, obviously you're going to show aging in your face at 45 years of age. To get up on a program, what do you recommend? How long does the treatment last? And how many treatments do you need to have? How frequently? And then do you space them out over time?
So this is a great question. So I began doing BBL treatments on myself at age 43. So
by the way, you don't look a day over 43.
Thank you, because I'm turning 65 in about 2 weeks.
Yeah.
So, but I have an advantage. I have BBL, and I've done about 120 treatments over the last 25 years on my face. So let's say that you're in your 40s. What would be the best recommendation? Well, most of us, by the time we get to be in our 40s, we do have some visible age-related changes in our skin, some accumulation of sun that we've had over 45 years, some loss of volume, some wrinkles have developed, some sagginess in the face. So we know that BBL can slow down those changes. But if you haven't done anything for your skin, or very little, let's say, and you're in your 40s now, the best way to start is to come to a center like yours that has BBL and has expertise in BBL. Be evaluated, and then you start on initially a corrective program, which we recommend is usually 5 treatments. You do 1 treatment every 3 or 4 weeks initially. That corrects your skin. Once your skin is corrected and now it's clear, it's smoother, it's younger looking skin, it's healthier looking skin, then you can keep it young and you can keep your skin clear and you can keep it healthy by we recommend 1 treatment every 3 months. And that's the optimal, I believe, anti-aging regimen using broadband light or BBL. The advantages are there's no downtime with treatment. The treatments take about 15 minutes to do on your face. And you get a result, you begin to see a result in your skin, often within 1 week of the very first treatment, where skin starts to look better on the face. The more treatments that you do, the nicer your skin looks. The smoother it becomes, the tighter it becomes, the more wrinkles will lessen. So there's really no upper limit of how many treatments you can do. But as a minimum, 5 treatments to initially start to correct your skin. And then after that, 1 treatment every 3 months.
So once a quarter, 4 times a year. Now let's talk about somebody who's older, in their 60s or 70s. Is it too late for them to do any treatment with BBL?
Well, I think that you'd give the same answer for somebody who's in their 60s and 70s about when they're starting on a bioidentical hormone program and a supplement program and changing their lifestyle. And the answer is no, it's not too late. They might need a few more treatments for correction, but we can still transform that 60, 70-year-old person who's never done any treatment for their skin and make their skin look much clearer, much healthier, even a lot younger with BBL. The word of advice that I would give to your audience is you want to go to somebody who is expertly trained in BBL because this is a device, it's a technology, but how you use it on someone's skin takes expertise. And so I would highly recommend the most important thing is that people seek out the expertise like you offer at your health and wellness center where you have BBL and you have now a number of years of experience and very experienced staff. That's really key to being able to get the best results. So no, you can be in your 60s, 70s. I've started treatments on people in their 90s and treat quite a few people in their 80s. And we have an opportunity now to have a generation of people in their 60s, 70s, and 80s who have great looking skin because of BBL.
That's wonderful. Now, there's some additional procedures that can be done with the Cyton machine. For instance, skin tightening. Tell us about that. And how does that
tightening.
How does that differentiate? How is that different from BBL?
Skin tightening, or what's referred to as skin tight, uses BBL. So it uses the same light that we use for transforming skin, but it flashes the light differently. And it uses slightly different color, mostly red and infrared light with skin tight using BBL. So for the audience, skin tight that you offer and that I've done thousands of treatments with, and I use regularly on myself, skin tight uses BBL, but in a very special way. And what it does is it can help on the face, tighten around the eyes, tighten the lower face, make the face look younger when we combine it with BBL. I've also discovered over the years of working with BBL and BBL skin tight that there are other very special applications of skin tight. And those that you'll have an opportunity, I think later we'll have an opportunity to share and talk to the audience in the future. But this is a very special use of light, is skin tight. And we use it primarily on the face and the neck to make that the face looks smoother and tighter, lessen wrinkles, and the same with the neck area.
Now, I've got a little gobbler right here. You see it?
So that's typical for most of us in our age group, yes.
And so skin tight will help with this, though, won't it?
Well, we would recommend if you wanted to do a treatment that would involved zero downtime and you wanted, that skin looking a bit tighter in the neck area. For those of us, even when we're in our 60s and up, the easiest treatment that somebody could do is combining the BBL treatments with BBL skin tight and that combination. And that's my favorite, most combination treatment to do for the lower face and the neck area as a method of getting the best, really the best result for people, have them look the youngest. It won't address everything, and not for those people that really might be a candidate for doing a facelift or neck lift. It won't do quite what that does. But for many people, the vast majority of people that don't ever really want to do cosmetic surgery, BBL plus BBL skin tight is a great treatment to do.
Now, what about halo laser treatment done with the Cyton machine? Explain that to us, and how does that relate to the BBL and skin tight?
So as you have just alluded to, the halo laser is also on the same machine that does BBL, the same Cyton device or technology. And the halo is a very special laser treatment. So it is used to complement what we do with BBL. It's also used to treat people when they have a greater degree of aging change in their skin, with more sun damage, with precancerous changes, or they have more wrinkles and lines. Then we'll add the halo laser. And it's also used for acne scars when people have been left with acne scars. So halo is a very special laser that uses two laser wavelengths, and those two combined make the treatment gentler than previous laser treatments, and So the recovery is easier, but they also are nearly as effective or almost as effective as the really aggressive laser treatments that had been done years ago. So Halo, and especially when the Halo laser treatment is combined with the BBL treatment, this is a very exceptional treatment to be able to make skin look really so much younger and nicer, and to address things like greater degree of sun damage, even early precancers and acne scars.
Now, doctor, I know that you have published literally hundreds of papers, and you've delivered at literally thousands of medical conferences around the world on the really remarkable and outstanding results that you've experienced by treating your patients with broadband lighting, with skin tight, and with halo laser. It's just remarkable. When I went and saw my first one, I met you about 10 or 15 years ago, went to a conference, and I went to one 5 or 6 years ago, and I went like, we've got to do this at the Hotze Health and Wellness Center, because I know our women feel great, but I know every woman really wants to look her best. I mean, and they spend a ton of money on cosmetics and all kinds of facial work everywhere, trying to keep themselves looking young. So first and foremost at the Hotze Health and Wellness Center, we help people get their energy, vitality, and enthusiasm back. Then we want to make sure they look their absolute finest and best. And that's why we have associated ourselves and aligned ourselves with the number one rated dermatologist in the world, the dermatologist who devised the treatment of skin rejuvenation of the face using first IPL and then broadband lighting and now halo and skin tight. And he is sought out by physicians all over the world to get training, and he does a tremendous job. He's been here at the Hotze Health and Wellness Center in the past and trained our people, and I consider him our mentor. I wanted to make sure if we offer these type of procedures that we are trained by the world's best, and that would be Dr. Patrick Bittert. I want to introduce to you now our new anesthetist, Nina Bergeron. Nina, thank you for coming onto the program today. Take a look at the camera and say hello to everybody.
Hello, everybody.
Nina is professionally certified in laser treatment, facial. She has 5 to 6 years experience on broadband using BBL sight time machine, as she's been doing photofacials for 11 years. She trains around the state other anesthetists to do this procedure. And I wanted you to know that we have brought her on staff because we wanted to get the highest quality we possibly could, a woman with great experience, and that's why we brought Nina on staff. So you're going to have an opportunity to visit with you. Tell them how we evaluate. The first thing we do when a guest comes in, tell them about the photograph that we take of the patient and how we use that to help determine what their needs are.
Yeah, great. We'll bring the client in and really just kind of get a good look at their skin, find out their skin type, talk to them a little bit about what they might
But
be.
we have that machine.
Yes. Then we'll take them back. So we have a Visia. It's really, it is also the best. It's going to take a very detailed, kind of like an inside-outside picture of the skin. It's going to see the stuff that we can't even see. It's going to see the UV damage that would eventually come up with time, and let us see really the best game plan at getting in there and getting all those treatments done.
So when you come in, Nina will be the one that will be doing the consult, doing the photograph of your face using our special camera to see what kind of damage you currently have, and then making the recommendations for the program that you need to be on in order for you to rejuvenate your face. And Dr. Bittert, am I wrong? What do most people say? How many years do they feel like it's knocked off their appearance?
Wow. Well, with what we and you can do with BBL now, for those people that are in their 60s, we make their skin look more like they're in their 30s. now. And most people feel they look 10 to 20 years younger when they've gone through a series of BBL treatments, the photofacial procedures that you offer.
And remember, folks, this is really a non-medical surgical intervention. We're not talking about doing any surgery on your face at all. We're talking about using specific wavelengths of light that stimulate your skin to rejuvenate itself. And that's what this Cyton machine, which is top drawer, and this was developed with Dr. Bittert's techniques and with his recommendations. The Cyton company built this. And Dr. Bittert is the one that has developed the techniques, the way to determine at what level of lighting to give each patient. So we have specific algorithms that he has developed, and we use his algorithms to make sure that with each individual person, we individualize the treatment program so they get the maximum benefit of facial rejuvenation. And let me just tell you what, your face is going to pop when you get this done. And we look forward to having the opportunity to serve you here at the Hotze Health and Wellness Center. So, Dr. Bittert, thank you for a great program. Thank you for the outstanding, incredible work you've done. Really, you have been an innovator. You've thought out of the box when everybody else said this wasn't going to work, it's no good. You saw the benefits when everybody else saw the obstacles, and you created a huge, wonderful medical procedure done with broadband lighting that has literally transformed the lives of hundreds of thousands, if not millions of patients who now really look their very best. And when you look good, you're going to feel more confident about yourself. Life's just a whole lot better. So thank you, Dr. Bittert, and congratulations on your success.
Oh, thank you very much, Dr. Hotze. I would conclude really by saying that what you offer with broadband light today, we only dreamt about 10, 20 years ago. And I would also say with great confidence, as you properly pointed out, experience with this technology with BBL is really imperative. I wouldn't hesitate to come to the Hotze Health and Wellness Center and have a BBL treatment done on myself. So I totally would trust what you do there. And I'm very picky and very vain and very particular. And I don't just say that about anybody. So people can certainly have the confidence that they know they're in very good hands, trusting their treatment and their BBL treatments to what you offer there.
Well, thank you again, Dr. Bittert, and we look forward to having you back on our program in the future. God bless you, and say hello to Alba for me too, please.
I will. Thank you very much.
Now,
all right.
Now, for those of you that are interested in our broadband lighting aesthetic department, don't hesitate to give us a call here at 281-698-8698. And by the way, for those of you that want to feel healthy and well as look healthy and well, give us a call at 281-698-8698. Here's a copy of my book, Hormones, Health, and Happiness. That'll get you educated and get you on the path of health and wellness naturally. Again, thank you, Dr. Bittert, and thank each one of you, too, for joining us here today on Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.